San Diego Mayor Maureen O'Connor admits to a billion-dollar gambling habit, including using funds from a foundation to support her hobby. Well, listen to this. She says that several brain tumors contributed to her actions. Well, joining us this morning is UC San Diego neurosurgeon Dr. Clark Chen. Doctor, good morning, and thanks for being with us.
Good morning. Thank you for having me.
About 30 seconds before we came on camera, I asked you straight up. I said, Doctor, can a brain tumor really cause somebody to do something like this? And I was a little shocked with what your answer was, which was?
Yes, I think the biological explanation of how a brain tumor could cause behavioral changes is absolutely plausible. I think that the tumor could sometimes cause pressure on the portions of the brain that controls your impulses. Depending on the location, some tumors could even change the chemistry within your brain as to alter your craving for certain behaviors. So it is absolutely plausible that a brain tumor could be associated with an addiction issue.
Now, the former mayor is saying that this is the reason why she did that. I want to take a little listen to what she has to say. That's what she said at a press conference. Listen.
It dealt with things such as judgment and the ability to control impulse.
It was at a time that in my life, I guess it's the last chapter of my life, where I lost my husband, I lost 3 of my siblings, I lost my 2 best friends. I always intended to pay it back, and I still intend to pay it back.
Would there be any symptoms? Would she have known that this was happening?
Probably not, but what that segment pointed out was something far more important. That is, the issue of gambling addiction is a highly complex phenomenon that's influenced not just by biological factors like brain tumors, but also by social circumstances. What you just heard was Ms. O'Connor saying that she was dealing with depression at the time when she realized she had this addiction. And it's known that depression is also a trigger for addictive behaviors. It's a way for some patients to escape from the unpleasant feelings associated with depression. So my suspicion is that this gambling addiction is likely the culmination of many social as well as biological factors of which the brain tumor can indeed contribute.
Look, I think we're learning more and more every day with the stories that we cover that this brain is so complex and what it makes people do. Would there be any symptoms? Let's say somebody at home would be wondering, well, maybe I have a brain tumor. How would you even know that you have a brain tumor?
Boy, that's a really, really difficult question. Some presentations of brain tumors are very dramatic, and so we know something's wrong. Someone doesn't wake up when they go to sleep. But other things could be very subtle. Before we came on the segment, I was sharing with you the story of one of my patients who came to me because her husband realized she wasn't being as argumentative as before, and it turned out that she had a brain tumor that compressed on the area of her brain that produces speech. And after I took out the brain tumor, she was back to her usual self. And there are days when the husband commented that he wished I hadn't performed the surgery. So it's sometimes very difficult to tell, and it really takes knowing someone very well and seeing behavioral changes that triggers alarms that leads to MRIs.
So if you see any of those, maybe of those changes or whatnot, that's when you want to talk to a doctor.
Absolutely.
Okay.
Absolutely.
Well, doctor, we appreciate you being here. This is serious stuff, even though, we want to sometimes joke about it because we think that maybe it's a laughing matter in some areas, but it obviously can lead to more serious things that we're all learning about on a day-to-day basis.
Absolutely.
So we appreciate you being here.